Amayina gange ninze Nangobi Patricia nayingira mu kitongole ekya Teenage Care ku 2023 era kyanamba ino najja nayiga ekyalaani.
Teenage pregnancy is a significant concern in Busoga with a prevalence rate of 21% across most districts. In fact, the region holds the highest teenage pregnancy rate nationwide, with 34% of teenagers getting pregnant. The districts of Kamoli and Mayuge are particularly affected with 6,535 and 6,205 teenage pregnancies reported respectively in 2021. The issue of teenage pregnancy in Busoga is further complicated by factors such as early marriage, with 49% of young females married off prematurely and limited access to education and health care. Many teenage mothers in the region lack support from their parents and communities, leading to school dropouts and limited future opportunities. To address these issues, Teenage Care Uganda has provided support to these mothers in form of clothes, medical treatment and mental health support.
Tulina birawo betulese wano byetujogabira imwe. So abaana bobanga oli wa mwana muto ngoli kwenda by'abaana tubyawire mwe by'abaana tubyawire ne byaba kutukoze eki tubyawire. So tujabiga mu ngeri eyo tujasoka tugabe eby'abaana byonka. Kuba mwena abali wano mulina abaana.
Tongole nga bino byabizze. Byagala kujeno tuzuule ani ko tusobola okukwatagana naye bebaani betusobola okubanga twongera otambula nabo.
So kati njagadde okweyunga ku Teenage Care Uganda kulabirira bano abaana abato. Waliwo abaana abato bambi nga batata baabwe oba bazadde baabwe tebaliiwo, abamu nga bazadde baabwe we bali nenga tebalina busobozi. Naye njagadde olunaku olwaleero nga omwaka guggwako, kubanga omwaka guba guggwako abantu babawa abantu eba season yakuddiza ku bantu.
Nze bande tanabire Jamila nga nvira wane Mayuge Town Council. Ekitongole kino kinambye ino kinambire irala. Nze ng'omuntu shange makunga nino omwana wange nga nzira buyambi najja ewakiso nasomera ekyalaani batutiikira ng'ebyokulya bisangayo ebyokunwa obwidandabi era wendogera wano n'ekyalaani bakimpa kati ndi bulungi ntunga batugabira wano ebintu obiviireeyo eby'abaana eby'abantu abakulu engoye ebyokulya byona.
Amayina gange nizadikiri Salimati mvira Busakira B tutikaya enambye ku obyobulamu nebyo yanama ku mwana wange ne family yange yona.
Born and raised in Mayuge, CEO Bazalachi Edmond was motivated to launch this initiative to empower teenage mothers.
I saw my friends, those that were sent off to get married and those that got pregnant while in school, give birth. Some of them managed to give birth to kids, and some of them, their kids and themselves, my friends, died while giving birth. It was a very bad situation for me. I didn't understand why this was happening. Why young girls were giving birth to fellow babies, to fellow kids. It was a very bad situation. I saw my friends giving birth to kids they couldn't support. These kids, the babies ended up getting malnourished because I think of the, poor feeding and everything. It was a very bad situation. So I've grown up in such a situation, seeing these teenage mothers suffer in that regard. So I say to myself, what can I do to at least render support to them?
Whereas these girls have parents, after getting pregnant, they are forced out of their homes due to poverty levels in the region.
We realized the parents had chased these girls because themselves can't afford to take care of their families. And when this girl gets pregnant, it is an additional burden of which the parents feel they are overwhelmed. So they end up chasing them, telling them, you go and stay with the person that made you pregnant. So we provide food stuff to them. We provide clothes because of the high poverty rates in Busoga, these girls and their babies lack what to eat. So we extend clothes. The other thing we do is we provide sanitary wear, sanitary pads, because in Uganda, sanitary pads are still expensive.
Through partnerships with stakeholders, Teenage Care Uganda aims to raise awareness, establish a vocational institute, and build a facility to support these mothers.
Teenage Care Uganda has a facility in Mayuge district which doubles as our office, TCU offices, and also our skills training center as of now. But very many girls come in. Those that have enrolled to get skilled, to study vocational skills, that is tailoring, hairdressing, bakery, and others. Those that enroll are just a small number because we are still having a small facility and we can't support all. So this is where we come in to seek for support. We need a bigger facility. We aim to establish a vocational training school for these teenage mothers where they can run to and gain skills, vocational skills that they can use to at least start up some small businesses to earn them. We would love to establish a health clinic, because one of the challenges that we face is these girls have medical challenges.
However, funding remains a significant challenge.
The Ministry of Health has a policy that supports teenage mothers, but when you go on the ground, the reality is these girls have not benefited at all. Every day we receive around 10 to 15 young mothers who need support from us as Care Uganda. But when you ask them, there are other options. Have you tried out to go and maybe go to government, maybe go to your local, local councils to seek for help? They tell you there is nothing. So we need more help because we can't do this alone. The numbers are overwhelming. We are now having 500 teenage mothers plus in our care, of which, because we are still a young organization, it is a very big number.
Edmond's vision is to create a supportive ecosystem that enables teenage mothers to overcome poverty, rebuild their lives, and secure a bright future. Naguja Serena, NSTV.
Teenage Care Zula mwebale nnyo.